All right. Well, welcome everyone. My name is Lisa Hirsch, and I am the Family Resource Center Coordinator at Atkinson Elementary. Today's conversation about Medicaid Open Enrollment and Managed Care Organizations is sponsored by a group of Family Resource Centers. We are here today because open enrollment for Medicaid enrollees is happening right now, and it goes through December 15th. And open enrollment is the only chance for beneficiaries who are already receiving Medicaid to switch their managed care organization, and you might hear those referred to as MCOs. We wanted to bring the MCOs to you to share about the benefits their organization provides, because it's really important that you have the information you need to make the best choice for your family. So I've written in the chat, but just so you know, for more information at a later time, you can go to connect.ky.gov for more information and support, and that is kynect.ky.gov. And you can go to the website for more information and support and get phone numbers to call if you'd like to talk with a real live person. So I just want to make sure that everyone has their computer set to mute, and you can put questions in the chat. And if you're unfamiliar with Google, the chat is like the little text box icon. It looks like a little speech bubble. So if you click on that, you can type your questions in the chat, and Regina Jackson-Willis and John Custis are going to be monitoring that chat. And they'll make sure that the questions get asked and answered at the end. So with all of that said, we are going to start off with Aetna presenting, and we have Amy Coleman from Aetna, and each presenter gets 10 minutes. So we'll kind of keep track of that time and let you know when your time is winding up. So go ahead, Amy. Thanks for being here.
You're welcome. Thank you for having me. My name is Amy Coleman, and I'm a Community Outreach Coordinator with Aetna Better Health. And I'm just going to go over a few of our benefits, the extra benefits that we have with our plan for 2021. And one of the benefits we have is eyeglasses and fittings. Adults get a free pair of eyeglasses every 2 years, and kids get a pair every year with a prescription. And we also offer hearing aids and screenings, the yearly exam, and you get the yearly exam is free, and you also get one free hearing aid per year. And it's unlimited visits for hearing aid fittings. And we also do home delivered meals. And with this program, it depends on your situation. If you just got released from the hospital, then you would get home delivered meals. You would just need to call member services to let them know your needs and also your situation to get those meals. And we also offer a free lockbox for medications, and it's just to keep your kids from not getting into the medications that they don't need to get into. And we also offer Campus Ed. Campus Ed is a program we offer for our members to help them with their GED certification and also with job training. And we also have enhanced transportation, and that's eligible for members. They can get up to 10 free round trip rides per year, and it can be used to go to job interviews or training or go to the grocery store, getting to the doctor, anything you need. They'll give you a ride for that. We also offer a back to school assistance program, and school age kids get a free backpack full of school supplies. And also, if you guys know of any kids that need school supplies, or if you just need school supplies for back to school, then you can get in touch with Aetna, and we will provide those for you. And it can be other than back to school. Just let us know, and we'll get that to you. And we also have we won the contract for SCI, and SCI stands for Supporting Kentucky Youth, and it serves children and youth in foster care and Medicaid eligible youth in the juvenile justice system. and also for foster youth under the age of 26 and youth placed with victim kin. And with that program, there is a program called Connections for Life, and that's for children ages 13 through 17. They get a free smartphone and wireless plan. And also for ages 18 to 26, they get a free laptop. Also, they can get a foster care duffel bag, and the duffel bag is filled with personal hygiene items, and also birthday in a box. And that's for eligible members to get a birthday in a box that includes party supplies and a gift. And we also offer health literacy programs. And the programs we offer are diabetes nutrition, and that's just a one-time class. We also offer micro clinics, and that's a 10-week program to help people to live a healthier lifestyle. And we also have Health Runs Deep, and that program is for pre-diabetics, and that is a 12-week program. And we have a slow cooker nutrition class, which is also a one-time program, a one-time class, and after that class, you'll get a free slow cooker. And we have Getting on Track, and that's a life skills class for youth transitioning into adulthood, and also it could be for someone coming out of jail and re-entering into regular society. And that was mostly geared towards foster youth, but also it can be for any age group. Anyone can participate in that program. And the sessions that we have for that program are budgeting, how to sign up for SNAP benefits, how to apply for FAFSA, just a variety of different sessions. And you can have all the sessions taught, or they can be split up. And also we have Catch My Breath, which is for grades 5 through 12. It's an e-cigarette prevention program. We have 4 sessions that are 35 minutes each. And also we're training a program called I Can In the Trend, and that is a program through UK for it's peer-led to get kids to, I guess it's for tobacco prevention, to get them from to stop smoking or not start at all. And that is led by peers. It's a peer-led group. The peer is a college student at UK, and they'll come into the classroom and just teach different sessions. And we also have In-Depth, which is taught one-on-one or in a group setting. It could be that instead of suspending someone for smoking at school, they can just come to these sessions. It's more like an in-school suspension type of thing. And those are 4 50-minute sessions. So those are just a few of the classes that we do have. And if you guys are interested in any of those classes, just let me know and we'll set that up for you. What we're going to do with those classes, we're going to start teaching those virtually in January. So if you guys are interested in that, please let me know. And that is everything that I have. Do you guys have any questions for me?
I think we are going to hold off and answer questions at the end, but I appreciate your presentation. It sounds like if you choose Aetna, not only do you get, a lot of the medical support, obviously, but you have some other social service and cooking and nutrition and school supply, other types of support that kind of helps families become more well-rounded and healthy all around. So thanks for presenting.
Thank you.
You're welcome. If you stick around, I'm sure we'll have some questions at the end. Next, we have Jamisha Joyner from Humana.
Hello, everybody. I actually have a presentation. Would it be okay if I present it? Okay.
Sure.
Okay. So I'll go ahead and get started. We're Humana Medicaid, known as Humana Healthy Horizons now. We changed our name. We want to make sure that we help our enrollees achieve their best health and live their best life. So that is the reasoning behind the name change. And as stated before, open enrollment is November 2nd through December 15th. So that's going on currently right now. Just basic what we cover. As far as dental, we have 2 cleanings every year for each enrollee. We cover extractions, a set of x-rays every 12 months. For children under age 21, we cover other services such as preventative care, such as oral health screenings, fluoride treatments, filling for children at risk for tooth decay. We cover fillings and medically necessary diagnostic and treatment services. For medical coverage, we'll cover visits with your physician assistants, your PCP, or a nurse practitioner. We cover treatments for, just regular visits for treatments for members under age 21 under EPSDT. We cover preventative services for all members, including vision and hearing services. As far as therapy, we cover physical, occupational, respiratory, and speech. There are podiatry services, mental health and substance abuse disorder services. We cover chiropractic services as well as renal dialysis. For vision, we are continuing to cover the annual vision exam, testing, care, and management of eye disease. Vision exams are covered for, again, everyone. For children, we cover 1 pair annually, and we will replace them should they lose them, break them, or the prescription changes. One new benefit that we are excited about is eyeglasses for adults 21 and over. Similar to the previous speaker, we cover eyeglasses every 24 months for those adults. Any additional glasses can be provided under the EPSDT guideline. And if medically necessary, eyeglasses, contact lenses, or prosthetic eyes are covered. And we do cover the eyeglass fitting, correction, and repair. Now to the fun stuff, what we reward our members. We have a health app called Go 365, which is eligible with Android and Windows as well as Apple. We are covering these services. You have an opportunity as a whole, the whole program has opportunity to award up to $415 in gift cards for members doing certain services such as breast cancer screening, and that's for women between ages 50 and 64. We will reward for the cervical cancer screening, dental visits for children, 2 per year, $15 for each dental exam, diabetic renal exam, just skipping to the next line, the flu vaccine, your health risk assessment, which we offer every member to do once they enroll in our plan. Level of care education, we want our members to learn about when to utilize the ER, and then they take a quiz and they can be rewarded for that. We reward for postpartum, prenatal, tobacco cessation, well child visits up to 6 per year, $10 each, your well visit and weight management program. For enrollees 18 and over, you are eligible for rewards. You'll just need to make sure when you enroll in the program for Go 365, make sure that you have your Kentucky Medicaid ID, which will be the other card that you receive when you first enroll in Medicaid. And any enrollees under 18 must have a parent or guardian to register on their behalf, and they will also need their Kentucky Unbridled Spirit Medicaid card. And I do want to let you guys know, in order to receive the rewards, you do have to make sure that you enroll in Go 65. And here are some of the extras that we have to offer. We do have a cell phone benefit. It has changed this year. Last year, we offered 1,000 minutes with unlimited text and 1 gigabyte. This year, through SafeLink, we offer 350 voice minutes, unlimited text, and 3 gigabytes of data per month. If an enrollee does have case management with Humana, they may be eligible for unlimited minutes and 4 gigabytes. We are offering something new, child care assistance, up to $40 per quarter for caretakers 21 and older, participating participating, in job-seeking opportunities through Humana's Healthy Horizon Workforce Program. And we are still developing that workforce program as well, but we do plan to help our enrollees look for employment. 1 additional cleaning per year, which goes under the 2 cleanings per year for adults. We also have something new, doula services for our expecting mothers. They do have to find their own doula, but once they do so and set that person in place for to assist, we will get in contact with the doula and go about seeing how to cover those services. We cover GED test preparation for 16 plus. We have home visits for high-risk pregnant members, delivery of in-home maternity services for high-risk enrollees unable to travel. We have another new item, our Mom's First Give. You can receive a portable crib after attending at least 7 prenatal visits, 1 per pregnancy. And this is another benefit that's exciting that's new. We're offering up to 26 additional chiropractic care visits. That's in addition to the basic 26 that we cover now, and 24 acupuncture care visits per year for enrollees who are considered to have chronic pain, and that's for ages 21 and up. Post-discharge meals, we offer up to 10 home-delivered meals following discharge, or from inpatient or residential facility up to 4 discharges per year. Again, our eyeglass benefit for our adults every 2 years. For enrollees ages 21 and over, we are reimbursing up to $300 for criminal record expungement, and those are Class D felonies, typically non-violent or non-sexual assault, something that doesn't harm another person. We will offer digital apps for diabetes management, prenatal care, breastfeeding, and newborn care. We cover sports physical per year for children ages 6 to 18, and our tobacco cessation program, which you can also earn rewards as well during Go 365. For enrollees age 12 and older, you get up to 8 health coaching cessation support calls within 12 months of first coaching session. And for enrollees age 18 and older, nicotine replacement therapy upon request. And our Mom's First program, just a little bit about it. In order to receive rewards, again, you have to be enrolled in the Go 365 reward program. How to enroll in Mom's First, you can call Humana, and that's the first step. You make sure you go to your OBGYN visits. Within 3 to 8 weeks after a baby is born, make sure you set up your follow-up appointment, and then take your child to the well child visits. And you also get one-on-one care with a care manager. So just going to your prenatal visit, you can get $25. Make sure you complete your first prenatal visit within the first trimester or 42 days of enrolling in the plan. For postpartum, you can get $25 going to your postpartum visit, and up to $60 in rewards for going to the well child visits between ages 0 and 15 months. And for anybody, qualification purposes, we do not do enrollment, but if anyone is curious if they qualify for Medicaid, this is an eligibility table just to show where someone would fall if they are interested or do not have insurance and need to know of a insurance option. So, and if you have any questions, my information is right here. That's my email address, cell, and if you're ready to switch and enroll, you can call Humana Healthy Horizons or the Department of Community-Based Services. And as you guys have stated before, we have connect.ky.gov. And that is the end of my presentation, you guys. Thank you for listening. Oh, I'm sorry. And I had one more announcement. I'm sorry. We are doing a partnership with JCPS, Walgreens, and the YMCA. We're doing 15 schools next week. We're supposed to start Monday, with helping to administer shots for children. So they get a free shot. If you do not have insurance, we'll still cover it for you. I think Anthem, I don't want to speak, I don't know if Wellcare, not Wellcare, excuse me, Anthem and Aetna are out of the network for Walgreens, so we'll still cover it for them as well. So we're doing that. I don't have an official flyer right now, but I can get it out to you guys once I have that information. And I also send a copy of our value-added services as well to Mr. Custis, and he can distribute it to you.
Thank you, Jamisha. I think we're gonna hold off on questions till the very end, but that was a great presentation, and thanks for sharing all of the incentives to stay healthy. I'm sure families will really be excited about that. So our next presenter is going to be with Passport, and that is Diane.
Hi, yes, Diane Coursey. If you can see, I told them earlier, my Google name is under my mom, so ignore that. I am Diane Coursey, and I'm with Passport Health Plan. Our official new name is Passport Health Plan by Molina Healthcare. So for those who aren't aware, we were purchased by Molina. Brand will stay the same. People will still refer to us as Passport, of course. So I am going to also share my screen to review our value-added benefits. So the extra perks that come with Passport. Do you guys see it? Can you guys see my screen? There's nothing on. Can you guys see this?
Yeah. Now we can see it.
We can see it.
Okay, perfect. I can't see you guys, so thank you for saying that out loud. So with Passport by Molina Healthcare, all standard benefits are the same. I'm just going to go through some of the extra benefits and rewards. So to start, we do have our Healthy Rewards program still. So members are able to earn gift cards for preventative care. This is an action to incentivize people for making sure that they're going to the doctor, they're staying compliant with their visits. And to start, for new moms, if you attend one postpartum visit, 21 to 56 days after the birth of the baby, you will be eligible for a $25 gift card. And if you go to a prenatal visit during the first trimester or within 42 days of enrollment, you will be eligible for a car or a booster seat. This is a new benefit for us that we have not previously provided. Also, another new reward is for diabetics. So if you do have diabetes and you're between the ages of 18 and 75, you do your eye exam and your A1C lab work, you'll get a $50 gift card for each one. So you have the option to earn up to $100 there. For females between the ages of 50 to 74, if you are doing your yearly mammogram, you will get a $25 gift card each year. And for children between the ages of 1 to 3, if they have at least 6 well-child visits on time, they'll get $10 per visit with a max at $60 in gift cards. And for females between the ages of 21 to 64, if you're getting your annual PAP test, you'll get a $25 gift card. Also, between the ages of 16 to 24, if you get your chlamydia screening, you'll get a $25 gift card. That's also a new benefit this year. Also, new reward is for those members who may have a hospital stay, whether this is hospital or a behavioral health stay. If they do follow up with their PCP within 7 days, they'll get a $50 gift card. This incentive serves as many people leave the hospital, they don't do their follow-up. So hoping that with this incentive, they will do their follow-up within the first 7 days. All adults 18 and older, if you get your annual physical, you'll get a $25 gift card. And all members across the board, if you visit your dentist at least once a year, you'll get a $50 gift card. And this year, you also do free sports or school physicals between the ages of 6 to 18. Also new this year, which we are very excited about, is we finally have glasses. We have been asked this question over and over again: when would adults get glasses with Passport? So happy to announce that in 2021, every 2 years, likewise said by the previous MCOs, adults 21 and older will be eligible for a pair of eyeglasses or contacts. Also new this year is we are providing Weight Watchers for all members. You get up to 13 weeks of Weight Watchers for free. The only thing they'll need is a prior authorization. Referrals can come from themselves, providers, their case management. We still do the SafeLeak free phone. Nothing has changed with that. You get your 350 monthly minutes, unlimited text, and a gigabyte of data. We are also doing vouchers to take the GED test for free at testing centers. This is for those who are 18 years and older. You will also get a gift card of $50 for passing the exam. Another new benefit this year is we've got a CVS discount card. So all members will be eligible to get 20% discount on CVS brand health-related items. Another new benefit this year is for those members with asthma. So if they do sign up and complete 3 months of our asthma disease management program, they'll get free pillowcases and mattress covers. And also for children, new this year is they will get a second inhaler for free. So previously we just covered the first inhaler, but now at no extra cost, they can get that second inhaler. And also another new benefit is Passport is now covering respite care. That way caregivers can have some relief time if they need it, and that's 8 hours per year that they'll get that. And that is it. So I will hold and wait and see if we have questions at the end. Again, if you, I'll put my contact in the chat, so that way if you do have questions, comments, or concerns, or want additional follow-up on a full throttle of the benefits, you can let me know. Thank you.
Thank you so much, Diane. And that's a really good idea. So presenters, if you want to put the name of your MCO and your name and your contact information in the chat, then any families or Family Resource Center coordinators who want to follow up with you to ask more questions, or if they have private questions they want to ask and not on a Google Meet, they can do that. I like that idea.
And
so,
I'm sorry. And
yeah,
I will
go ahead.
do that. I will put that information like at the bottom of the screen. When I get the video back, I'll put that information like on the actual screen, if you guys are okay with that.
Perfect. And
Awesome.
I'll also send a copy for John so that he can share internally the benefits document as well. Thank you.
Cool. So next up we have UnitedHealthcare, and that is Victoria Jude. So take it away, Victoria.
Can you hear me okay?
Yes.
Unfortunately, I was having technical difficulties, so I'm unable to connect through my computer. But I'm on my phone and I still want to be able to show the presentation. So if you can still somewhat see, can you see it, or is it backwards?
Yes, no, that's fine. What I'll do is I will present my screen and I will pin you to the top so everybody can
Thank you.
everybody can see. All right,
Okay.
I think we're good. Go ahead.
Thank you so much. Sorry about my face. Okay. My name is Victoria Jude, and I am the Community Relations Specialist at UnitedHealthcare Community Plan of Kentucky. We are a new Medicaid managed care organization in the state of Kentucky with a beginning service date for our members of January 1st, 2021. But however, we are working behind the scenes to get everything together for our start date. So I've put together a short presentation to give you guys just a better idea of who we are and some of our member benefits and value-added services that will be included in our 2021 start date. This slide talks about the importance of UHC partnering and collaborating with communities in which we live and work. As the slide says, we are committed to providing responsive, compassionate service to the economically disadvantaged and the medically underserved. In our commitment, we want to ensure we are providing the highest quality of care through strategic partnerships with providers and community organizations. And we deliver that care through quality with an integrated, comprehensive view of an individual's needs. We don't want to just slap a Band-Aid on someone's issues or expect their social determinants of health needs to be met. We want to ensure that we're helping our members with the whole person health. UHC Community Plan strives to empower healthy habits through member benefits and value-added services. So this includes $25 gift cards for adolescent teen well visits, $15 gift cards for dental visits under the age of 21, coaching and online support through the Quit for Life program, where members can get assistance with quitting tobacco and deciding the right care plan towards quitting, assistance with managing chronic conditions through our health education and wellness programs, Boys and Girls Club memberships for after-school care, and social support. This provides members access to a housing navigator, to transportation coordinator, and a member advocate for specialized services. Members can also get a $50 gift card participating in QMAC sessions. So we're required to have quarterly member access committees where we invite our members, community-based organizations, and providers to join the committee to give us feedback on what's working, what issues you may have, or insight into what our plan offers. Those members that attend will qualify for a $50 gift card annually for participating. So it's a great way for them to let their voice be heard. They also get a $15 gift card for completing diabetic or pre-diabetic A1C or retinal eye exams. Just one second. 0 copays for doctor visits, hospitalization, or prescriptions, of course, and no cost mobile phone services that do include the talk, text, and data. We want to provide free text messaging through, it's called Text for Baby, for expectant mothers to provide that extra support and guidance to the members during their pregnancies, and direct access to key member health information through our UnitedHealthcare app, which is up. Along with empowering healthy habits, UnitedHealthcare Community Plan also provides additional programs and tools for the members. For behavioral health, it includes mental health, substance use disorder treatment, and rehabilitation services. Any Suboxone or Vivitrol treatments do require a prior authorization. But along with this, we provide online tools to help with managing stress and access to 30 free acupuncture visits. With the acupuncture visits, members must be 18 years or older with a diagnosis of lower back pain or migraines. Members can also connect to a live doctor through smartphone or computer for any non-emergent visits. They have access to a 24-hour nurse line and case management for assistance with any comprehensive service coordination. And I do want to explain some on this next program. The On My Way program. It is offered to UnitedHealthcare's youth members. UnitedHealthcare's On My Way is an engaging, interactive program that informs Kentucky youth and helps prepare them for many real-world situations that are ahead. This program teaches the practical skills of managing bank accounts, securing housing, creating a resume, finding job training, and applying for college. It is a reliable go-to source that they can use throughout their journey toward independent living. Members can access this program through uhcomw.com or through the MyUHC mobile app. Now, I just want to give some details about some of the tracks that is offered through the program. The first track is Money Matters, where they provide information about bank accounts, calculating income, creating a budget, filing taxes, and protecting identity and credit. The second track is Employment, where they can learn what type of job is a good fit for them, where to search for the jobs, and tips to prepare for an interview or build a resume. The next one is a housing track where they can understand their housing options, compare options, learn about the necessary paperwork for housing, and establishing an emergency housing plan if needed. The next track is education, so they can learn the value of a high school diploma, options for education after high school, and job training that is a right fit for them. And then we have our health track, where information for teens on sex health, pregnancy, and behavioral health concerns, including anxiety, drugs, and alcohol abuse. And the last key track is transportation. So it gives them tips around about getting around town and what to expect when owning a car and staying safe. So moving on to the right side of the slide, you'll see that members can locate resources through the uhc.com website, such as in-network providers and dentists, preferred drug lists, and over-the-counter medication that's covered. All of that is attached to our website for them to access at any time. Then we have our Healthy First Steps program for expectant mothers who want to participate in this specialty care program to get extra support with their health and the well-being of their baby during the pregnancy. So with this program, the pregnant moms can actually receive a $15 gift card just for enrolling. They get a $10 gift card for postpartum visits, and they can receive rewards throughout the program, such as safety kits, books, thermometers, teething rattles, just for reaching their 24-week and 32-week and so on milestones. Next is, along with the live calls that members get from care managers and our case management program, members will also receive IVR appointment reminder calls for any annual appointments with their PCP. And lastly, we have our home delivered meals program for the diabetic and pre-diabetic members. This program will provide 14 free home delivered meals to those members who have been discharged from the hospital. That is one delivery with 2 meals a day for 7 days. So UnitedHealthcare Care Coordinators will reach out to the diabetic and pre-diabetic members once they've left the hospital to set up the meals. And then, of course, if there's any members out there that have any questions, concerns, want to learn more how to get connected to these programs, they can call our member service number at 1-866-293-1796. And our website is uhccommunityplan.com/KY. I have added my contact information, and I'm not sure if you guys can see it at the bottom. I am, again, the community relations specialist, and my work number is 763-292-6615. And I've also added our provider advocate. So if any providers have questions about getting in network with UnitedHealthcare or accessing our care coordinators for referral processes, her name is Molly Mills, and it's 502-241-9915. Of course, if you like any further information, I can send you guys some flyers and stuff as we go. But please feel free to reach out. I would be happy to assist you guys with whatever you need. And thank you guys so much for taking the time to learn about UnitedHealthcare.
Thank you so much, Victoria. That was great. I appreciate it. And Darren, thank you for hanging in there and being the last presenter. We appreciate your patience. So next up, we have Darren Levitz from Wellcare.
All right. Let's see if I can share my screen. And let me know if you guys can see that. New platform.
Yep, looks like it's working.
All right. Well, thank you, everyone, for sticking around. My name is Darren Levitz with Wellcare. I'm going to jump right in it because I know this is number 6 for a lot of you. First of all, it's been a tough year for all of us. And I think, we still got some obstacles to overcome next year. And nothing important is more important for Wellcare than taking care of families in Kentucky. So we are going to continue our no-cost co-pays and $0 co-shares for next year, because the one thing we want to make sure is that cost is not going to be a barrier to care for our members. So that's really important to us. I want to give you just a super quick overview of why we positioned or why we created some really exciting new value-added benefits this year. We sat down, we talked to our members, and all across the state, young and old, every culture, every ethnicity, just everything. It was really interesting is the feedback they gave us was very consistent throughout the state, and that was they wanted us to enhance our vision care. They wanted more over-the-counter benefits for their families. They wanted more incentives, some exciting new incentives for their healthy rewards programs. And not surprisingly, they wanted us to keep everything else. And I'm really excited to say that we've been able to fulfill every one of those requests. So first of all, I'm really proud to say that I believe that Wellcare is going to be the only health plan, Medicaid plan this year that is going to be offering not only new glasses, but new contacts. And that's every year for our members. So that's a brand new benefit, adults, new glasses and contacts every year. We will, of course, continue to provide new glasses for our younger members, and then a second pair if the first pair is broken or replaced. And if they're like my son, you definitely will need that. Our over-the-counter benefit has greatly increased this year. It's up to $300 per year in free items delivered free to your home. And I know a lot of us are really reticent about going to the grocery and just feel safer of anything that can be delivered. So our most popular benefit, we're going to be increasing. And you see the dollar amounts up there, but those are for Wellcare members. So if you have 3 or more Wellcare Medicaid members in your house, that's $25 over-the-counter items delivered free to their home every month of the year. As I talked about, our Healthy Rewards program, a lot of the same type of behaviors that others have talked about, doing your well visits, getting your mammograms, all those great things. We are offering, in addition to $25 gift cards, which we've done in the past, we're now offering a new benefit of Amazon Prime memberships for our members. They're available in 3-month increments, so that's really exciting, and that's the full benefit. So not only free delivery of items to their homes, free deliveries from Whole Foods to their homes, but it's music, it's video, it's audiobooks, it's the full complement of that membership. And then for members who are that have completed 2 activities, they wanted Fitbits. So we're really excited to be offering that as a healthy reward and a way to encourage healthy lifestyles. And collectively, if they complete all the activities, that's up to $425 worth of items this year. So really excited about enhancing our Healthy Rewards program. Another new program that we're offering is Weight Watchers, and that's 6 months of a program. Again, we're really focusing on improving the health styles and lives of our members. So a 6-month program, you see the parameters down there. We're working a couple different ways for people to join. That can be through a caseworker that can recommend it. We're training our providers to be on the lookout and be aware of this benefit, so they can recommend that to members. And of course, members can self-refer themselves if they feel that's a program they would like to participate in. We're really focusing on moms and moms-to-be, their baby. We're offering free cell phones to moms with unlimited data, talk, and minutes. We, again, want to remove those barriers to care and never want someone to be watching their minutes or their data when it can provide them access to not only their caregivers, but their families and friends. A lot of us are isolated right now, and being connected is more important than ever. We've got a number of different items that we are giving to moms-to-be, so you can see the selection of those items. They can enroll in our Text for Baby program at no cost. And our 24-hour nurse advice line is available at no cost to not only our moms and babies, but for all of our members. But I want to call that out, especially for this group. We want to focus on our children, our younger members as well. We will continue to have free Boy Scouts and Girl Scouts for all members. And that membership extends to parents and guardians, too, that are going to participate. We're also making a $25 credit towards the cost of uniforms for that. We have our sports physicals again this year, and our GED program will continue for free. We've also broken that out based on some member feedback. Again, we're really listening to our members. They do not need to take that test all at once anymore. If they want to take that into any one of the 4 sections, we will pay as they go. So that's a new benefit. And then another brand new benefit I'm really excited about is that we're offering 50 members $1,000 for scholarships for those members that will be attending college. So that application will be available on our online portal for our members, but $1,000 up to 50 members. Hopefully, again, trying to make better lives for people in Kentucky. Continuing that thought on how to improve their lives, all members are eligible to get a free, free cell phone with 350 minutes, 3 gigs of data, unlimited texting. We've got some great programs, Steps to Success and Wellcare Works, that really help them through life skills and making them productive members of our society. And again, removing the barrier of criminal records. We will help work with them to expunge those costs and cover that certification fee so they can re-enter the workforce as productive members. We also have a lot of great resources that we offer for free to our members. There's a lot of barriers to care that happen outside of the doctor's office that definitely affect our lives. So, we help people find homes. We help them with childcare assistance. We provide all kinds of food assistance and transportation. And you see these. We have connections to literally tens of thousands of organizations, and we offer that service at no cost to our community at large. We have a lot of different telephonic resources. Our 24-hour nurse line I talked about, community connections I just referred to. We have a 24-hour crisis line. We've all seen and heard about emotional and drug and alcohol and physical abuse has been increasing under COVID. So our 24-hour no-cost crisis line is available for all of our members. And then we also offer a meal program for people that have been discharged not only from hospital, but behavioral health in rehab and skilled nursing homes as well. So in conclusion, really, really excited. We think 2021 is going to be a great year for people in Kentucky. It's going to be better than this year, right? But no cost Medicaid, zero copay, zero cost share, free glasses and contacts every year for adult members, over the counter up to $300 for family, our great health rewards like gift cards and Amazon Prime, Fitbits. We've got our 6-month Weight Watchers program, great programs for moms, babies, children, and then a lot of work in life skill support for our adult members. So again, thank you for your time. Really excited about being able to continue as the plan that has the highest rating for member and provider satisfaction and the largest number of Medicaid members in the state. So it's an honor to do that for people in Kentucky. Thank you.
Wow, thank you so much. I know I have learned so much about, especially about all of the extras that all of the MCOs are providing, and it's great to hear a focus on the whole person, like a well-rounded view of health. And so I know all the information provided today has been helpful to the Family Resource Center coordinators and the families. At this point, I know Regina and John have been monitoring the chat for questions, and so I'm going to let them either ask those questions or call on those people to ask those questions so that we can make sure to get even more information out to everybody.
Okay, I've got, this is Regina. I have 2 questions. For Jamisha, the question was regarding the flu shots. Are those shots just flu shots or any shot?
No, it's just flu shot. It's going to be like a drive-through event. Again, once I get a flyer, I will definitely send it out to be distributed, but it's going to be a drive-through. There'll be a pharmacist who will administer the shot, and then there'll be someone just to monitor everyone on site, just to make sure there's not any adverse reactions, and we'll have little things like giveaways. But yes, it's just the flu shot at this time.
All right, thank you. And the last question I have is for Diane with Passport. The mattress covers that are provided for students or kids, families with asthma, will it cover if the issue is bed bugs as well?
Good question. I am not certain on the bed bugs, but I can definitely ask. If that person doesn't mind to share their contact, I will follow up and get an answer to them.
That was actually my question, because we get a lot of questions about bed bugs with our families in the district.
Okay. Okay.
We have a high number of kids with asthma in the district as well. And
Okay,
we feel that a lot of that is from the bed bugs.
Agree. So let me get back to you on that. And do you want me to send the question to you, or you want me to get it to John so the whole team gets it? How do you want me to?
You can send it to John. That's fine.
Okay, perfect.
That's all the questions that were in the chat.
I have a question about several of you guys mentioned transportation, and I was just curious what and if everybody offers about the same, that's fine. Not everyone has to answer, but we do have families who struggle with transportation to appointments, and so we will give bus tickets. Sometimes we're not allowed to transport families, but I'm curious what type of transportation assistance is available and if it's kind of across the board for everyone.
I can go first. As far as medical appointments, we partner, I think it's the Bluegrass Federation. I'll have to get the correct name, but we do partner with them for medical visits. So I believe every person that is under Medicaid should be eligible at least for transportation to medical appointments. So that would be something they might want to look into for their plan.
That's correct. It's across the board to and from medical appointments. That if they have Medicaid, they'll be able to have that transportation.
Okay, that's good to know. So maybe when families approach us, we need to just make sure to let them know to check with their MCO and find out what the rules are, how far in advance they need to call, that kind of stuff, because that definitely comes up a lot. And I know with behavioral health, when families miss like a medicine check appointment, they're often very frustrated because they can't get a refill of a prescription that they are desiring for that child. So that's really good to know. Thanks.
And I know for me, I have no problem. I've done it several times in the past. If a member wants me to help them set their appointment up, I don't care to do that. So definitely feel free to share my information with any of your families.
I have one. A few of you have talked, or at least alluded to having a case or a care manager that would be assigned, I guess, assigned to a family or a household. How would a family go about obtaining one of those?
Okay. Well, with Humana Medicaid, you can just simply call member services and just request that you want a care manager. I believe that's a requirement of the Medicaid for each plan to provide care management, but you can just call and request if you want. So when we're back out in the community, you can let one of our community management people know, and then we can get in contact with someone and have them contact you. So there are several ways they can get a care management, but it's at the member's request.
Agreed. Same with us. And again, I always tell people I don't care to be the bridge. So same thing with that. Sometimes people like to avoid member services. If they need assistance, they can always call me and I can get them connected and get them set up in a program, or they can just call member services.
In speaking for Wellcare, members obviously can call member services and self-refer, but we also do go through, look through the data where we identify people who may be in need of services and proactively reach out to them and recommend different programs through our care managers and case managers.
And that's the same with us too. They would just need to contact member services and we would get them in contact with a care manager.
Yes, and our provider relations team will work directly with the providers if they want to go through, refer the patients out to any of our programs as well, if they want to go through their doctor.
Something I heard that I'm excited about is I know many of you talked about providing glasses for adults and also replacement glasses for children. That is something else that comes up a lot with our families, losing and breaking glasses. And, you know, sometimes with our families moving a lot or having lots of kids, that can just cause some chaos and things get lost or broken. So that's good to hear as well.
You know, I'll share a quick story. It just kind of grounds all of us in what we do is talking to a member once, and we said, you know, doing these focus groups, and we said, you know, if you could have anything, pretend I'm Santa Claus, right? You know, what would you want? And, you know, stop and think what you would say, you know, if that genie could grant you any wish. And she just said, I want glasses. She's like, you know, this was a small, you know, I'm not going to even name the town, but a small little town in Eastern Kentucky. You know, you imagine, and we're like, we're just going to make that happen. And that's why we made that decision to offer glasses in contacts. So you want that also every year. I mean, but just think about that small gesture and how life-changing that is. I mean, I know how horrible my life would be without my glasses. I mean, how simple that, you know, that impactful that is to change. So it's just wonderful to be able, you know, I'm glad to see that so many people are doing that. But, you know, we want to make sure that, you know, this is a kind of about what Medicaid does, and don't forget about, you know, the members that we all serve. And I think that's great that people are taking on adult vision, even though it's not required by the state.
Some of these services are real game changers for our families. I know it doesn't seem like much when you say that you can buy 6 packs of diapers or 5 packs of diapers, or you can have food delivered to someone who has no one cooking for them or looking after them when they get home from the hospital or extended care. Some of these things are real game changers. Expungements, I was blown away by that you all will help with those kinds of things. It just says we're much more concerned about the total person
Yeah.
than we've known healthcare to be in the past. Thank you.
Well said.
Yeah, I just want to, it looks like we're kind of wrapping things up. Your role is so important, especially right now. So thank you for participating in this. We're recording this, and so we're going to upload this to our YouTube, and so it'll be available to everyone in the district, and we'll be advertising that as well. So thank you very much. I'm very hopeful and certain that that will help our students and families. I mean, not only they might switch, they might not. They might find something that they can already qualify for in your all's programs, and that they just didn't know about. So that's what I'm really excited about, is our families taking full advantage of what you guys are offering, and I'm very thankful for what you guys are doing.
Thank you for hosting.
Thank
you
you.
all for coming.
Thank you.
Yes, thank you so much for having us.
Thanks, everybody.
All right.